Welcome to my COVID-19 workshop. My name is Mary Banza and I will be the facilitator. I will just quickly going to remove my mask so that I can speak clearly. We're going to start with a icebreaker. We need 2 people, please. Vincian and Jemima, can you please come in front here? Thank you. Jemima, you can stand here. And Vincian, can you please stand on that side? Yeah. We're going to play a game. Each one of us are going to pick a paper right here, and then you're going to open it. You don't tell the other what you have, but you just need to express it. You just need to express what you have, what is written on the paper. So I think you guys understand the game. You understand, Jemima? Yes. Vincian, you understand? Okay, can we do it?
Yeah.
Okay, thank you very much for your participation. Okay, Vincian, you can pick a paper. Jemima, you can also pick one paper. And I will also pick a paper. Vincian, you can open your paper and express what you have, what is written on the paper.
Okay. Fever.
Vomiting. Diarrhea.
Yeah.
Oh, okay. Okay. Yeah, you can put this paper that you already used here. Thank you. And Jemima.
Headaches.
Yeah. Okay.
Cough. Vomiting.
Yes, vomiting. And you can take another paper, please. Cough.
Yeah.
Okay. You can put it there. Fever. I don't know.
No.
Chest pain. No.
No. Tiredness.
Oh, tiredness. Okay.
What? Oh. Sore throat.
Yes. Okay, Vincian and Jemima, thank you for participating. They are my little sister. The purpose of this icebreaker was just to make you people aware of the symptom of the COVID-19 so that you know a little bit more. Thank you very much. Okay, we're having rules in the house for this workshop. Phone on silence, please. Be engaged on this workshop. Ask question at the end. and be on time. I will quickly going to cover the journey of the workshop. We will cover what is COVID-19, the stage and symptom of the COVID-19, main type of COVID-19 transmission in South Africa, ways of preventing COVID-19 transmission, what to do if you are infected, and the last one is COVID-19 treatment. I will quickly going to give you a background or history of COVID-19. COVID-19 was first identified amid an outbreak of respiratory illness case in Wuhan City, Hubei province in China. It was initially reported to the WHO on December 31st, 2019. On January 30, 2020, the world declared it a global pandemic. I will also give you a definition of COVID-19. Coronavirus disease 2019 is defined as illness caused by novel coronavirus, now called severe acute respiratory syndrome, coronavirus 2, SARS, formerly called 2000, and COVID by the WHO. The acronym derived from the coronavirus disease 2019. The name was chosen to avoid stigmatizing the virus origin in terms of population, geography, or animal association. Actually, the coronavirus COVID-19 affecting 213 countries and territories around the world and 2 international conventions, according to European Center for Disease Prevention and Control, since the 31st December 2019 and as of 26 July 2020, case of COVID in accordance with the applied case definition and testing strategies in affecting country have been reported. Now we're quickly going to speak about the stage and symptom of coronavirus 2019. What are the different stages of COVID-19? The first stage is imported cases. These are those who have traveled to virus in foreign countries and have come back to India. Basically, what are this trying to say? It's trying to say, let's say you are a South African from this country, then you travel to, let's say you travel to India or Italy, then you contracted the virus there, then you come back. So this is what we call imported cases. The second stage, which is local transmission. These are those cases who have come in contact with patients who have travel history. So basically what they're trying to say here, let's say that person who contracted, a South African who contracted the virus, let's say in India, and has come in contact with another person, then this is what we call local transmission. Stage 3, which is community transmission. This is the last and the worst stage, where the disease takes the shape of epidemic with no clear end point like it did in China. what they're trying to say here, this is whereby now no one will tell you, including your doctor, can't tell you, okay, now you have contracted the coronavirus and it's going to end, let's say for instance on Monday, Tuesday. No one knows when this the end point of coronavirus, like it did in China. Epidemic, which is stage 4. Community transmission is when a patient not exposed to any infected person or one who has traveled to any of the affected country test positive. Large area get affected when community transmission takes place. Now, let's move to the symptom of COVID-19. According to mayoclinic.org, sign and symptom of corona disease 2019 may appear 2 to 14 days after exposure. This time after exposure and before having symptom is called the incubation period. Common sign and symptom can be included. So now here you can contract, let's say the virus, you contract it like now or today, but you can only know about it or to find out after 14 days. Then you can know that, okay, I'm infected or not. So the symptom can include fever. You can have fever and cough, tiredness. You can feel just your body becoming weak. About 15% of the confirmed cases progress to the severe phases, although there is higher chance of patients over 65 to progress into severe phase. One of the biggest question to answer is why some develop severe disease while others do not. So let's say I'm just going to give you quickly an example, and I will ask you participants to be involved and to answer to this question, please, if you don't mind. Let's say someone who got someone who is diabetic and the other person is not diabetic, and the both contract coronavirus. Who do you think is going to be healed faster? What do you think, Jemima? Between the person who is diabetic and the other person is not diabetic?
The diabetic.
The diabetic one. And Vincian, what do you think?
The person with...
Can you speak louder?
The person with diabetes.
Okay. Yeah, so basically if you have already like medical condition, you are more exposed. That's why they even saying, like they even like advising for people who got already like chronic disease, medical condition, to stay more at home, to avoid like public area, like do not go to the mall often, because you going to be more exposed, because you're suffering already of like a disease, another disease, and then if you contract the coronavirus, it's just gonna be like, so that's why they're busy advising you to stay at home, especially for people who got medical condition. Okay, as you can see here, some symptom of the COVID. This is a person who is coughing, and this one has fever. You see, so those are the symptom of the COVID-19. Early symptom of COVID-19 may include a loss of taste or smell. Other symptoms can include shortness of breath or difficulty breathing. Here, this is where by now you will be struggling to breathe. Yeah, you will be struggling to breathe normally. Yeah, so if you feel if you start having that kind of symptom, you must seek quickly for medical care. Okay, among the symptoms, you can also have a sore throat. You feel pain here. Your nose can be running. You can have headache, chest pain. So, what are the main type of transmission of COVID-19? According to current evidence in South Africa, COVID-19 virus is primarily transmitted between people through respiratory droplets and contact routes. Droplet transmission occurs when a person is in close contact within 1 meter with someone who has respiratory symptoms, for example, like coughing or sneezing, and is therefore at risk of having his mucosa from mouth or nose or conjunctiva eyes exposed to potentially ineffective respiratory droplets. You can become infected by coming into a close contact about 6 feet with a person who has COVID-19. So the spread can go like when you are like in close contact with a person who has contracted virus, and yeah, you definitely you're gonna be exposed to it. You can become infected from respiratory droplet, like what I was saying earlier. You may also be able to get it by touching a surface or object that has a virus on it. Okay, let's say for example, this surface here has the virus on it. Then I just came and touch this surface, so I have like many chances of contracted the virus. Or let's say for example, you have to touch your phone. The phone has coronavirus on it. Then after touching your phone, you touch your face, then you can contract the virus. So amongst the ways of preventing the COVID-19 transmission, you need to ensure hand hygiene. Okay, you need to make sure that you wash your hands regularly. You need to wear your mask. You see, this is my mask here, and you need to wear it properly, not like other people, they're wearing it like this. You're wearing it like this. You are like this, and then you're going, as you can see, that you need to wear it properly this way. Can you see? Yeah. So this is how you should wear your mask, and you must always have your mask when you go let's say to the mall, public area. and you need to wash your hands correctly. I'm gonna show you how. Jemima, can you please come? Can you give me the soap? Yes, can you hold for me, please? Can you please come? Okay. This is how you should wash your hands correctly. This is the soap. You can and remember, you can use any soap that you have at home, as long as it's a soap you can use. Yeah. So I put this way the soap, and I wash my hands correctly. Very important. You need to make sure that you wash your hands correctly. Don't just wash it like in a rush way, then no. Wash it correctly. You wash correctly your hands just to protect yourself also, you know. Yeah. Thank you. Okay. And among the way of preventing the COVID-19, you also need to maintain social distancing. Like what I was saying earlier, among the ways of preventing coronavirus, we have organizational measure, which is the first one. The organizational measure aim to minimize the probability of being exposed to COVID-19. For this purpose, measure must be taken to avoid new infection or even the spread of the virus where it has already been present. So the organizational measure, basically, it's more for organization, for companies. Possible 14 days home quarantine. So it's good here to be safe and to work from home. If you can work from home, it's better, and you're protecting also yourself. But if you decide, in this case, to return back to the company, I think they will advise you to quarantine yourself even for 14 days, just for security purpose, you know. And reduction of number of operators which each are confirmed environment, selective control and measurement of body temperature of all supply and external collaborator. So I will take an example here, for, let's say, for any bank. So they're dealing with external people who are coming from outside. In order for them to be allowed to enter the bank, it's not just only the bank. Now everyone are doing the same thing now. Even like Pick and Pay checkers, in order for you to be allowed, they're going to test your temperature to see if you are, let's say, an example. I will just give you an example for you to have an idea. Let's say if you are under 36, 35, it's good. But if, let's say, your temperature is from 38, they can be worried and they can not allow you to enter, but they will advise you as well maybe to seek for medical care. The second one, which is environmental measure. Environmental measure are aimed at reducing the risk of transmission of COVID-19 infection to individual through contact with infected subject, with object, equipment, or contamined environment surface. So this is where I was just showing you that example. Like if you touch a surface that has a virus, you have more chance to contract the virus, because by there you become more exposed to it. And here you need to reduce close contact between work, colleague, or other staff by applying this recommendation. So let's say if you are like in a company, you're gonna be like close to each other, let's say at the break time you need to be like close to each other playing a game. Now you need to reduce those kind of stuff because you need to protect each other. Reduce direct physical contact. This is what I was saying. For example, shake hands. Now you don't need, like, even the president said, like, huggies, shaking hands. Those things are now from the past. Now we're greeting like this way, you know. Yeah, I can just show you, this is how we greet now, because even the president said when he was addressing the nation that hugging, kissing, those things are from the past now. So yeah, the third one, which is personal measure, hand washing. Like I showed you how to wash your hands correctly. Proper hand washing is the essential measure to prevent the transmission of COVID-19. Hands should be washed with soap and water for at least 40 to 60 seconds. Like the way I just show you now. Don't wash it just in a rush way. Make sure you wash correctly your hand. And if soap and water are not available, at least use a alcohol-based hand disinfectant. I'm gonna show you now. Jemima, can you give me just the hand sanitizer, please? Thank you. So this is how this is a hand sanitizer, as you can see. Then you apply it. I make sure that I apply it everywhere, as you can see. Just for me to be safe, you know, you don't do it in a rush. I make sure I put it everywhere, I apply it everywhere. Yeah. You can also wear gloves if you want to, but you cannot use like your glove like more than one time. Like use it, like for instance, you wear your gloves now and you decide to go to Pick and Pay. Then when you come back, you take them off, you put them somewhere, and then tomorrow you want to go, let's say, to check us. Okay, you take the same gloves you wear. No, you mustn't do that. So now let's talk about what to do if you are infected of COVID-19. So this is very important, people. You mustn't panic. You mustn't panic when you are infected of COVID-19, because some people, they can just panic and then you have a heart attack. You mustn't panic. This is very important. First thing to do, you have to you need to seek for medical care. I don't know how you're going to do it. Maybe you can call them, but you need also to stay at home. Do not leave your home except to get medical care. Do not visit public area. When you are infected of COVID-19, you mustn't you just said, okay, you know yourself that you are infected of COVID-19, but you want to go like to the mall, you want to go to restaurants. No, you need to avoid those areas when you are infected of COVID-19. Go to avoid transmission. Avoid public transportation, like such as you need to avoid train when you are like infected of COVID-19. You need to avoid like public transport, like train, taxi, ride sharing. You need to avoid those things. You need to isolate yourself to avoid transmission. You need to stay in touch with your doctor to get medical aid, medical support, medical instruction, and be sure to get care. If you have trouble breathing, let's say, you stay at home and only to find out you start struggling how to breathe, you can't breathe correctly anymore, you need to seek for medical care immediately. You need to monitor as well your symptoms. You need to test, like, let's say each after an hour or 45 minutes you test at least your temperature, just to know and to monitor your symptom as well. It's very important. Now we're gonna talk about the COVID-19 treatment. According to Paul Gisbert, this sounds a French name. According to Paul Gisbert, an expert in infection prevention, treatment for COVID-19 depend on if the case is mid or more severe. For middle cases, resting at home and taking medicine to reduce fever is often sufficient. So here what he's trying to say is other people recover even without going to hospital. You can just recover like by staying at home, by isolating yourself, and by respecting what your doctor telling you. You respect the instruction and you can recover. But remember, you must avoid public area. So with treatment that may include supplement oxygen, assisted ventilation, and other measures. So assisted ventilation is more for people who are like hospitalized. In some cases, experimental treatment have been tested to see how effective they are. Example for therapies, antiviral or retroviral medication, breathing support such as mechanical ventilation, what I was saying earlier. So if you are like in the hospital and you're hospitalized, you need to stay there. Don't run away, so that they can help you and you can talk with your family. Let's say now we're having like video call, WhatsApp, conference. You can talk with your family. They can give you support through the phone, like through a video call. They can give you support. Blood plasma transmission to reduce lung swelling. So with this treatment, you need also to respect it. It's very, very, very important. And you need also to respect what the doctor are telling you, because it's also very, very important. As we are at the end of my COVID-19 workshop, do you have any question? Vincent, do you have any question?
I have a question.
Yes, Juliet, do you have a question?
Yes, I have a question.
What is your question, please?
What about traditional medicine?
I cannot say on traditional medicine because I've ever tested and the doctor didn't confirm on it. So I'm not very sure about it, but I can also try to do some research on it, but I really don't know about it yet.
Okay. Because in Madagascar they have a medicine.
Okay.
They made it with the traditional plant.
Okay, I heard about it, but
and they are saying that.
But I don't think that they didn't approve it.
Okay.
They only approve it like in some or 3 countries,
Congo,
African countries.
Senegal.
Yeah. Those are the countries who approve it, like Congo, Senegal. But I don't know about other countries if they approve it. Yeah.
Okay. South Africa did not approve it.
I'm not really sure. I cannot say if South Africa approve it or not, but I'm not really sure. But I know that Senegal and Congo approve it. Yeah. And thank you for your question, Juliet. Vincent, do you have a question?
No.
Jemima, do you have a question?
No.
Ryan, do you have a question? Okay, so I'm at the end of this COVID-19 workshop. Thank you very much for listening, and thank you very much for your participation as well. And as you could hear during my workshop, some sound on the background. Those sounds came from the Muslim people as they were praying. We could not just disturb them as well. So yeah, forgive me for that background, but yeah, that's it. Thank you very much. Bye.